Hello, I'm Greenbrier Almond. I'm going to be reading stories of my father today, Dr. Harold Almond, Stories of a West Virginia Doctor. We are reading through this book, and now today we are reading Part 5, Medical Education. Guinea Pig for the War Effort. In early 1940, General Douglas MacArthur reported that after successfully fighting off Japanese Zero planes, too many fighter pilots and their airplanes were lost by accidents on landing. These American pilots had flown without oxygen above the 16,000-foot mark and had used oxygen from a tank when they flew above 30,000 feet. To determine the effect of altitude on fighter pilots, an American physiologist supervised a study of medical students in a pressurized tank of oxygen. At Northwestern University Medical School, as a sophomore, I was one of the first guinea pigs in their simulated flight under pressure in a metal tank. The tank seated 12 of us medical students. We flew with oxygen from a tank in conditions that simulated 15,000 to 18,000 feet. The oxygen was given to us at that altitude because of a common sense lesson we learned from nature. We were taught that when you hike at higher altitudes and start to run out of oxygen, you start to hyperventilate. But when you hyperventilate, you blow off additional carbon dioxide and water, or H2CO3, i.e. carbonic acid. This leaves the blood in a relative alkaline condition. You start to notice you get spasms of their muscles, first in the fingers and hands. Your urine turns milky, where calcium phosphate and calcium carbonate precipitate out. If you check your visual acuity, it would be less. That is, your night vision is decreased. You get dizzy, you wet your pants, and you can easily stop breathing. In addition to being given the oxygen during the study, we were fed a high vitamin, high protein diet at the local hospital. I gained 5 pounds in the 3 months of this experiment. We studied during the hour while flying in this metal chamber. We finally learned to swallow correctly and were able to descend from 60,000 feet to Chicago's altitude in 4 minutes. We were all paid $1 a day for collecting all our urine daily for a 3-month period. Toward the end of the experiment one night, the medical student next to me collapsed out of his seat, lost his oxygen mask, and landed on his chest, face down. We all thought he had a heart attack. I was his neighbor to his left. I took 2 deep breaths, took off my oxygen mask, and sat him up. Another student put the collapsed student's mask back on, and I staggered to my place. Still another classmate put on my oxygen mask back on my face. I gasped for breath. Other students started the bells ringing to the outside graduate student, who rang the bell throughout the 7-story medical school. Dr. Andrew Ivy, physiologist and doctor and head of the department, ran down from the 5th floor to his experiment. We descended from 60,000 feet in 4 minutes. The collapsed medical student was breathing. He was rushed next door to the hospital. He had a spontaneous pneumothorax, which is a spontaneous collapse of his lung. Cause unknown. I felt fully recovered, but Dr. Ivy wanted me to go to the hospital. I told him I had to study for his examination the next day. He said I would pass the exam if I would go over to the hospital. I was checked out and was found to be healthy. I studied a couple of hours and passed the test on my own the next day. General MacArthur passed a law that all pilots flying with oxygen would have to fly over the flying field for 15 minutes anytime they had flown over 15,000 feet with an oxygen mask. All pilots were fed a high vitamin, high protein diet. The accident rate on landing was greatly reduced. The medical student with the collapsed lung recovered and saw service with the Coast Guard after graduation. Medical school. In the late summer of 1945, I was a senior at Northwestern University Medical School. Like all medical students in the past 40 or 50 years, it was my turn to deliver babies for the Chicago Medical Center. All deliveries, if they were normal, would be delivered in homes throughout the city. The first week, medical students were the assistants. The second week, they delivered. Backing up students were residents and attending physicians if anything went wrong. More serious cases were referred to Cook County Hospital, where 7,200 babies were delivered by their interns, residents, and attending physicians each year. The Chicago Medical Center was located in the near southwest part of the city on Halsted Street. There were clean rooms where we students slept or talked with one another. There were clinic work days for the pregnant women to visit and to be assessed by the student, resident, or by the attending physician. These homes where deliveries were made usually had running water, but not always hot. A thick layer of newspaper that had been saved by the mother was used as sheets for the delivery. All of us carried the satchel instrument bag emblazoned with the insignia of a pregnant mother and a newborn baby. Every policeman, bus driver, and trolley conductor in the city would stop his vehicle if he saw a young doctor carrying that famous citywide insignia. One day a call came in about 3 p.m. that a newborn's umbilical cord was leaking a drop of blood. I walked the 2.5 blocks to the baby's address and was welcomed. As I entered the small apartment, I didn't see the baby. The mother said he was in the next room. In the next room, I found no crib, no bed, and in fact, no baby. I returned and asked the mother where the baby was. She said he was in that room in a cage. I found him asleep in the cage and tied the new knot in his umbilical cord, and the oozing stopped. When I asked the mother why the baby was sleeping in a cage, she told me that another newborn baby in their apartment building had his thumb eaten the week before by a rat. So she put her baby boy in a cage for his own protection. A night or two later, we took the streetcar north on Halsted for about a mile and found the address to be located in an old store, now boarded up with thick old white curtain. We entered the building to find 6 gypsy men sitting on wooden stools, carving wood with long knives. On the opposite side of the door, 7 men were doing likewise. My senior partner asked where the mother was. One gypsy pointed with his knife toward an inner room. We 2 medical students checked the pregnant lady, now in active labor. I was the junior member of the team that week, so I left my partner with the mother and went outside to find a telephone. This was the standard operating procedure to call back to the medical center and report the progress. There was a light in a bar half a block south, so I walked down to it. It looked like a tough, grimy joint. As I entered, the bartender recognized the maternity center insignia and said, "The phone is over there, doctor." I called the center, reported the progress, and went outside. A large Chicago City policeman was walking his late-night beat. "What are you doing in this neighborhood at this hour, doctor?" I told him my partner and I were up the block at that lighted store delivering a baby. "My God, a man was stabbed to death there 10 days ago." He called for help, and within 10 minutes, 6 other officers were there. We entered the store again with the 6 policemen and their drawn guns. As soon as we heard the baby cry and made sure he was all right, we rapidly cleaned up the site of our recent delivery and left that address to the gypsy men and mother and her newborn son. One night later, that same classmate who was a Chicago native and I went down to about 30th Street in a rough section of town. About 2 a.m. we found the correct street, but could only locate the street numbers above and below the address of the resident in labor. Then we realized the patient lived down the alley between the two other numbers in an old carriage house. Up the stairs we met our patient, a very large woman who was very much pregnant. It was cold that morning, so I asked my partner to light the kerosene heater. He did, and it burst into flames. The patient kicked the door open, and then she kicked the blazing stove down the steps. It rolled down the alley and under our car. We hastened down and began pushing the old car. The pregnant woman in labor was pushing as hard as we were. The car didn't move at first, then it started rolling. We kicked the stove out into the center of the street and went back into the house. That mother delivered 10 minutes later. It was by far the most spontaneous, uncomplicated delivery that either of us ever saw up to that time. Internship. Internship at St. Luke's Hospital in Chicago in 1946 and 1947 was the most interesting and meaningful 18 months of my life. The hospital had 580 beds, with an older building for the rich and a newer 19-story building for the poor and the rich to share alike. It had a school of nursing, and students from the University of Illinois and Northwestern University worked hard there to become educated healers. In May 1946, I was assigned to the emergency room from 7 p.m. to 7 a.m. every other night. I also worked the clinic from 8 a.m. to 5 p.m. workdays. Here, the poor could receive good medical care. One morning, I was working the pediatric clinic and I saw a chubby 11-year-old girl. She had been born at St. Luke's and had all her shots and exams here at the clinic. This morning, she was getting her yearly physical, which was paid for by the health department. I examined her and found that she had no breath sounds in her right lung. It was also dull to percussion. She was not complaining and she was not sick. She was referred to X-ray for a routine chest X-ray. The chief of that department called me in to talk about this patient. The X-ray seemed to be a puzzle. It looked like muscle and hair. He wished that I would order up an overexposed film, which I did. The film showed the girl had a tooth or a teratoma in her lung. A teratoma is fetal tissue usually found in the ovary or testes. It is fetal tissue that started to grow with hair, muscle, teeth, bone, etc., but never developed because of a poor blood supply. It is known as a little monster. The chest surgeon removed the tissue from the right lung and the girl was fine. This is not a cancerous tissue, it is fetal tissue growing where it should not be. This so-called little monster is rare, but not unusual. Its presence in this young girl gave me the opportunity to give a unique presentation at the Clinical Pathological Conference the next Friday. One summer night, a police ambulance brought a gangster from the Loop in Chicago to St. Luke's Hospital. Our hospital was the nearest hospital to the Loop, or downtown Chicago. The patient had received a bullet through the intestinal tract. We sent him from the emergency room to the surgical floor to get patched up right away. 1 hour later, the night nurse and I were chatting with the hospital policeman. The hospital policeman's beat was the hospital, the church, the student nursing quarters, and a large printing office. The doors leading to the ambulance office were thrown open and 2 men burst in and covered us with their guns. My heart jumped. I was sure there was some thugs after the man we had admitted an hour ago. I was much relieved when the beat officer said, "It's okay, Sergeant." The police had been notified that some gangsters were indeed going to return and try to finish off their botched job of the man they had shot. My mouth had gone dry, and the nurse and I were speechless. I dreamed that night of the police and the Chicago gangsters. Another night in June 1946, the LaSalle Hotel in the Loop caught fire in the bar. It had highly polished woodwork and couches and stools that burned with a hot flame. The fire spread quickly to the upper floors. Few people were burned, but many became asphyxiated from the fumes. Our first notification was 2 ambulances with 4 patients. The ambulance drivers said there would be over 50 more people coming immediately. Fortunately for me, as the intern on call that night, I had the best nurse in the hospital. She was the assistant chief nurse in the nursing school. She had worked in the Frontier Nursing Service in Kentucky. She was tops. She efficiently told me to press the red button for all 30 interns and 6 residents and the junior attending staff. Call the chief of the hospital, Dr. Brown, and tell him I said to get his butt down here. I called. Dr. Brown said he would handle it alone, but I told him my nurse said to get his butt down here. He came. The nurse listed all admissions, their names, ages, if known or guessed at, their diagnosis, home address, if possible, and room and floor numbers the attending doctor assigned to that patient, all the while helping me and other doctors bandage, give shots, and dress burns. She even managed to talk to every new patient. She was worth her weight in gold. I loved my wife, but that night I loved my assistant. She and I admitted 55 patients, including 5 dead, to the morgue. She supplied the list with the above information to the Chicago newspapers 2 hours after our first patient, assigned a student nurse to each patient, and directed the hospital nursing staff to help with the care for the wounded and burned patients that night. The hospital chaplain said but he really meant she, handled the emergency. We did that work every night. The last patient admitted from LaSalle was a sailor from the Great Lakes Naval Training Center whose dad had come down from Wisconsin for a visit. His dad was one of our dead. The sailor was brain dead. He was asphyxiated with smoke. I checked him at 1 a.m. on the 5th floor. He was covered by the medical service, but no one had seen him yet. I did his history, did the physical, posted the diagnosis. I gave nasal oxygen that night, hoping he might recover, but at 7 a.m. he was still brain dead. He couldn't talk, eat, or control his bladder. The chief doctor of University of Illinois Neurology Department was hired by the Navy to care for him, and at 1 p.m. the next day I recited my findings to this doctor. He agreed with my diagnosis and thanked me for the sailor's care. The doctor notified the Navy and transferred the sailor to Great Lakes Naval Hospital north of Chicago. The sailor was brain damaged for life. This completes Part 5, Stories of a West Virginia Doctor by my father, Harold David Almond.